Well, February is National Children's Dental Health Month, and it focuses on the importance of teaching children good oral habits early, just to ensure a lifetime of healthy smiles. And here to tell us more about why it's just so important, as well as provide some helpful tips, is Dr. Angelo Vasquez from Tri-City Children's Dentistry. So thanks so much for being here.
Thank you for having me. Appreciate it.
So talk to us about the importance of oral health for kids.
Yeah, we definitely want to celebrate children's oral health awareness, and promote well-being as they kind of grow into young teens and adults. You definitely want to celebrate the, positive outcomes with being comfortable in your mouth and confident in their smile. So it's important to that. We also want to help, limit the risk of decay, with cavities being the most prevalent disease of childhood. So we're all about prevention and trying to stress that model from an early age on.
Yeah, and I know getting kids to brush and even floss their teeth could be challenging at home. So do you have any helpful tips for parents?
Absolutely. So especially with like infants, it's all about positioning. So we do typically what's called the lap position or a knee-to-knee position, where we're sitting directly across from the parent, child's facing towards you, head drops into lap, and we're just using some toothbrushes just to keep them open, another toothbrush to actually brush. So that way you actually have control of the child and you can see what you're doing. So when you can see what you're doing, parents can do a much better job, child's going to be nice and comfortable, and that's going to be the most important thing, is getting to that comfortable stage. Yeah,
and then any foods or habits that negatively impact kids? I mean, obviously candy and sugars.
Sure, well, there's a lot of added sugars to, processed foods. So, everything's in moderation. So, and the same thing too, like with a lot of snacking comes a little bit more frequent brushing and getting inside the mouth. So especially like brushing after breakfast, that's one of the main stressors that we have. Like some people forget brushing after breakfast, like still important, got to do it. And so brushing after breakfast and also brushing in the evening before we go to bed.
And then what age should parents start taking their children to the dentist?
Sure, so according to the American Academy of Pediatric Dentistry, we want to establish a dental home, by first tooth, which is plus or minus 7 months of age, no later than age 1. So the dental home, it's continuous, comprehensive, compassionate, so we want to stress that model so that we're seeing them from age 1 till about 18, sometimes even a little bit longer than that. And so we kind of, build up their confidence and trust and comfort in their mouth, so to celebrate, hey, their smile.
And the biggest challenge parents face when caring, for kids and their oral health, any other tips to overcome that?
We also have, complimentary desensitization visits. So we want to make sure that the child is comfortable, whatever their age or their background, whether it's a history of special needs or, phobias. And again, if they're just not comfortable, they're like the white coat syndrome. So, there's complimentary like desensitization visits where we have them come every week and say like, all right, here's a toothbrush, brush your teeth. All right, sweet, high five, here's a prize. I'll see you next week. So that way we're kind of building up their confidence and trust, and we're celebrating these little wins that these children have. And so by the time when we see them for the regular 6-month checkup, they're super comfortable and they're excited to see us. So that's the goal that we want prone, is their excitement, about their health, their oral health, and their teeth.
All right, and then any signs a kid needs more orthodontic care at the right time? And it's like my niece is 9 and she just got braces.
Yeah,
it's like, is that too early? Or?
So that, we definitely do, want to track. So according to like the American Academy of Orthodontics, you want a child to be seen, by age 7 or so, just to kind of track their growth and development. So it's more of tracking, and if they need help gaining space, orthodontists can kind of help see like, hey, we want to gain some space. Or if the children's like, hey, I'm not so happy about these crowded teeth, like, okay, what can we do to help? So we want to kind of help that in a proactive manner.
Yeah, and then with kids with special needs or disabilities, it could be even more overwhelming to come into a dentist office.
Yeah.
So what do you do for them?
So we typically will just have an office visit just to kind of show about like, what are your expectations, asking the parents like, what's going on with your child, getting, into their background, what do they like, don't like, do they, a crowded room, lots of stuff in their mouth. And again, just kind of slowly setting up a game plan. Like, all right, the same thing too, we'll have desensitization visits where, and then sooner or later, we're gonna look in the mouth, and sooner or later, we're gonna be comfortable in the mouth. So that's the most important thing, just kind of getting them used to the office and setting the expectations right from the bat. How can we be helpful to them?
Well, good. Well, thank you so much for joining us.
Thank you for having me. Appreciate it.
Good tips.